There we go.
Okay.
Hello.
Hi. Hi, moms. My name is Gerda. I'm the peer counselor, and Winnie John Wick. She's Kendra.
Yep, I'm also a peer counselor here at Whitney and Wick.
Nosotros somos consultoras de amamantamiento. Estamos aquí para ayudarlas a todas las madres que estén interesadas en amamantar a sus bebés y estamos aquí para ayudarla en todo el proceso.
Today we're going to be going over the benefits of breastfeeding for moms, babies, along with going over, when you should not breastfeed, how long you should do it for, and, breastfeeding in COVID too.
Yes, in COVID process. Yes.
Yes. Gerda will also be speaking Spanish today for our Spanish moms out there.
Yes. Estamos aquí, el día de hoy vamos a tratar sobre el tema de los beneficios sobre el amamantamiento, tanto para la madre como para el bebé, lo recomendable para amamantar a su niño, qué tiempo es lo recomendable para amamantarlo. También vamos a hablar sobre la situación del COVID, si puede seguir amamantando o no, y cuándo no debe de amamantar a su bebé.
Okay. All right, so first we're going to go over the benefits for mom. The benefits for mom is it reduces the risk of high blood pressure, type 2 diabetes, osteoporosis, postpartum depression, ovarian cancer, breast cancer. It also helps mom return to your pre-pregnancy weight and size. It also lessens the postpartum bleeding, so you don't bleed as much after you have your baby. It also saves a lot of time and money for you as well. Exclusively breastfeeding, giving no formula or pureed baby food, that can delay the return of your menstrual cycle, which is very good for, preventing pregnancy. If you don't want to get pregnant again.
Yes. What's neat with the moms is be exclusive with breastfeeding.
Yes.
It's only like bring breastfeeding milk to the baby.
Yep, you can't give any formula, and if the baby is 6 months or older, it also is ineffective because that's when you would provide pureed baby food.
Baby's food, yeah.
So if it's only, breastfeeding or exclusively pumping. Those two would also relay or postpone your period from returning. It can also help with anemia, and it's like we said before, it helps with spacing out pregnancies in children.
Before. Yes. Now I'm saying in Spanish. El amamantar a tu bebé para la madre tiene beneficios de que tiene reducción de cáncer de mama, cáncer de útero. Tu útero vuelve a la posición natural más rápidamente, te ayuda a perder peso, te ayuda con tu presión arterial alta, ayuda con la diabetes. O sea, tiene tantos beneficios el amamantar a tu niño para ti como madre. Tu periodo menstrual se retrasa por más tiempo. Si solamente estás dando leche materna a tu niño, ya sea directamente que lo estés amamantando directamente de tu seno o estés utilizando una pompa o lo hagas manualmente sustrayendo tu leche de tu seno, tú puedes usar eso como un periodo porque tu menstruación no va a llegar naturalmente de una vez. Se tarda un poquito más. Y lo puedo utilizar como método de prevención para salir embarazada nuevamente. Tiene miles de beneficios para la madre. Yo siempre lo recomiendo que amamante. Y ahora vamos a decir los beneficios para el bebé.
Okay.
The baby benefit.
So now we're going to go over the benefits for your baby. So for your baby, it reduces the risk of developing asthma, type 1 diabetes, obesity, childhood cancers, respiratory disease, ear infections. It also prevents sudden infant death syndrome, or SIDS, gastrointestinal infections, and necrotizing enterocolitis, which is inflammation of the intestines that's caused by bacteria. It can enter the bloodstream and turn into sepsis, which is very bad. It can kill your child.
Your baby.
Yes. So you don't want that. So breastfeeding prevents that. And it also develops the muscles in your baby's jaw. And also babies that are breastfed score higher on IQ exams.
IQ exams.
They are clinically proven to be more intelligent than formula-fed
For the
babies.
formula baby. Yeah.
Yeah.
Los beneficios para el bebé, lo reduce de infección de oído, infecciones de gripe. La leche materna es el mejor alimento para tu bebé, lo ayuda con la digestión, lo previene de problemas intestinales, previene a tu bebé de obesidad, le reduce la diabetes, ya dije la gripe también, reduce las infecciones, cualquier infección que tu bebé pueda tener, la reduce totalmente al tú amamantar a tu bebé con la leche materna.
All right. So now, is there really a difference? Some of you might be wondering, is there really a difference between breastfeeding and formula? So there is a big difference. So I want to start off by saying that breast milk is easier to digest. So breastfed babies, they typically, you'll see them eat more frequently,
yeah.
Because breast milk is easier for them to digest compared to formula-fed babies who eat less frequently, and it takes longer for their bodies and their digestive system to really break down the formula.
Yes.
Also, breast milk contains all of this stuff compared to formula. So as you can see, these are all the things that formula has, which is just water, carbohydrates, fat, protein, vitamins, DHA, and minerals. But if you breastfeed, you get all of this extra stuff. Growth factors, anti-pesticides, anti-allergies. It can help prevent your child from getting allergies when they get older. Hormones, antibodies, and antiviruses. It has antibacterial properties to it. So it's really good at preventing your baby from, getting ear infections or, getting sick with like the flu or COVID. It's very good and for helping prevent it and also build up their immune system to all those viruses that are out there.
Yeah, you can right away, you can see the difference. This is the breastfeeding components, and this is only the formula. The formula is it's only the necessary, like minerals, the fat, vitamins, protein, but look at all the stuff the breast milk is have. Todas estas son los beneficios que tu leche materna le provee a tu bebé. Todo esto que son los anticuerpos, antivirus, tiene hormonas, antialérgicos, tiene antiparásitos, tiene extraminerales, factores de crecimiento, vitaminas, grasas, carbohidratos, proteínas y agua. Mientras que la fórmula solamente tiene los minerales, vitaminas, carbohidratos, agua, grasa y agua. Entonces ustedes pueden ver toda la diferencia de lo que viene siendo la fórmula y lo que es la leche materna.
Okay. Also, there's other benefits to breastfeeding as well. If you choose to latch your baby, not pumping.
Yes.
But if you choose to latch, then it's always the perfect temperature for your baby. You don't have to worry about
heating and anything.
Making sure that, you don't burn the roof of your baby's mouth with bottles. It's always the perfect temperature.
And you don't need you latching baby directly on. You don't need bag.
No.
Only two pumpers and wipes, and that's it.
Yeah.
And bring your baby with you. But when you pump, like Kendra experienced, you need to care a little bit stuff, but 100% is more easy to bring formula to baby.
Also, it not only is it always the perfect temperature, but it's there wherever you go. You don't have to worry, I don't have formula with me. What do I do?
Yes.
I don't have a way to heat up the formula to make sure that it's sterile. A lot of people don't know that, formula is not sterile. You have to heat up the water and then add the formula to make sure that it is safe for your baby to eat and to consume because it's made in a factory. With breast milk, you don't have to worry about that. You don't need to worry about it.
Yep. You don't have to worry about any chemical on it. Everything is natural. I say all the time, the breast milk is white gold because it's have all that your babies need in your first year. Everything the babies need is only breast milk.
Yeah.
And now we talk about the COVID. The COVID pandemic is that you have COVID or you cold you can continue breastfeeding your baby. Did you have COVID? Si tú tienes COVID, lo voy a decir en español y Kendra lo va a decir en inglés. Si sales positiva de COVID o estás expuesto con una persona que tuvo COVID, puedes continuar amamantando a tu bebé. Lo tienes que consultar con tu doctor primario, primeramente, pero puedes hacerlo. Simplemente siempre lava bien tus manos, que siempre estén todas bien limpias. Utiliza una mascarilla, porque cuando estés hablando o practicando con tu bebé en el momento que lo estés amamantando, no lo pones expuesto. Y siempre limpiar tu área del seno. Y tu bebé está directamente dispuesto a amamantar. No tienes que tener miedo que porque tú tengas COVID o estuviste expuesta a COVID, debes de parar de amamantar. Puedes continuar amamantando. Igualmente, si tienes una simple gripe también, que he tenido personas que me han dicho, oh, me enfermé, tengo gripe, paré de amamantar porque no quiero infectar al bebé. El bebé no se infecta, no se enferma de esta manera.
Okay. I just also want to add before that it's also better for the environment if you breastfeed.
Mm-hmm.
You're not throwing out cans. You're just providing breast milk. So it's more eco-friendly. So now we'll discuss COVID. So a lot of people ask, like, oh, if I'm sick, am I still able to breastfeed?
Yeah.
And you can. So if you do have COVID, you just wear a mask, and you sanitize your hands. If you do have COVID, if you do test positive, if you cough down on your breast, then you want to sanitize your breast. If not, then, if they're covered, you didn't cough or sneeze on them, it's fine.
Yes.
But you can latch baby on as long as you're wearing a mask and your hands are clean. If you're not comfortable with that, when you are positive, you can just exclusively pump during that time. That way your baby is still getting the antiviral, antibacterial benefits to breast milk compared to, just getting formula. So
yes, 100%.
So it's definitely beneficial and it's definitely safe to breastfeed.
Yeah, this is somewhat because it's like some moms think like when I'm cold, I don't want to transmit the cold to my baby. Or some moms say I have fever for cold. I don't want to be my baby next to me because this okay that you're not feeling comfortable, but you can pump and take the milk out, or you can do the hand expression too for taking the milk out. Puedes utilizar tus manos para extraer tu leche materna o también puedes utilizar una pompa y de esta manera tú extraes tu leche y sigues suministrándole la leche a tu bebé.
Okay. Now we're going to go over how long should you breastfeed for. A lot of moms wonder how long you should, and it's different depending on where you go, like what websites you look at, but it's really up to you, But the American Academy of Pediatrics, they recommend that you exclusively breastfeed your baby until your baby is 6 months old. Only giving breast milk after 6 months. When you introduce complementary foods such as the period baby foods, they continue that you they suggest that you continue breastfeeding up until 1 year of age, but you can certainly go longer, or if you're just not comfortable with it, you can do a shorter amount of time as well. But that's what they recommend is exclusively breastfeeding for 6 months, introduce complementary food, period food, until baby is 1 year of age.
La Academia Americana de Pediatría recomienda amamantar a los niños hasta los 6 meses o más, porque después de los 6 meses empezamos a introducirles los alimentos sólidos, ya sea como frutas y verduras. Puede hacerlo por más tiempo, por el tiempo que usted quiera, pero lo recomendable siempre queremos que hasta los 6 meses, pero puede hacerlo 1 año, 2 años. Tengo clientas que todavía a los 2 años están amamantando a su bebé, lo que es perfectamente ok con eso, no hay ningún problema. La leche materna tiene miles de beneficios, como dijimos anteriormente, y por esa manera podemos tener, el bebé puede estar todo el tiempo saludable y no tener opción de enfermarse.
And I just want to stress that any amount of breast milk is good for both you and your baby. If you just do the first couple of days, when you just have the colostrum and you just do that, that's a lot of people call it their baby's first immunization. Which is like shots to prevent illnesses.
And some clients, sorry, Kendra, clients is say oh, I'm only breastfeeding my baby for 1 week. It's only for bring the cholesterol for baby, but it's no one breastfeeding anymore. It's only do it for 1 week for it can be only this colostrum for the baby.
Yep, so you can do that if that's what you wish, but it's definitely beneficial to breastfeed longer. If you can for up to a year, it does prevent a lot of illnesses for both you and your baby.
Yep, continue to the other side.
Oh, okay. So then when is it not safe to breastfeed? It would not be safe if you're taking certain medications, like if you have HIV or if you're taking medications for your HIV or if you have AIDS, it's not safe to breastfeed. Also, if you are on like certain birth controls that have like a lot of estrogen, you should wait until breastfeeding has been established first, if you can. Also, like if you are doing chemotherapy, you should not be breastfeeding. Any illegal drugs, you should not breastfeed then. Certain medications, like for migraines, mood disorders, not safe to breastfeed with those. But if you do have any questions, always consult your healthcare provider first to see if you can breastfeed. But those are the main reasons why you would not be able to. If you have HIV, if you have
tuberculosis too.
Oh yeah, tuberculosis, herpes, hepatitis. As you can breastfeed if you have hepatitis, as long as there's no lesions on your breast for it to be transmitted to your baby.
To the baby.
But mainly, always consult your healthcare provider if you're worried. Oh, I have hepatitis or I have herpes. I don't know if I can breastfeed. Always consult your healthcare provider. Make sure that they give you the green light. They say it's okay, and then if you wish to, then continue.
Continue, yeah. La única manera que debe de parar y no puede amamantar a su bebé es si usted tiene una de estas intervenciones médicas, que es cuando el médico te diagnostica con galactosemia. Galactosemia es cuando es una intolerancia a la lactosa, que hay veces que los bebés lo tienen, no puede darle ni fórmula ni leche materna. Cuando la madre tiene tuberculosis y no ha sido tratada. Si la madre tiene VIH, si la madre consume drogas ilegales, si la madre está infectada del virus linfotrópico y de las células tipo 1 y tipo 2, y si la madre es diagnosticada con ébola. Estas son las enfermedades que no puedes amamantar a tu bebé, pero siempre tienes que comunicarte con tu doctor primario y consultar con tu doctor sobre todas estas enfermedades para poder continuar amamantando a tu bebé.
Okay.
Now it's just about it.
Yes. We also have prizes for those of you who are, able to, follow us.
Yes.
Like this video if you'd like to, see more. This is the bag. We also have stuff in it. There's a total of 20 bags for participants that come to Whitney Young WIC. Unfortunately, if you do not attend this one, you are not eligible for the prize. But here's what's inside. We have an unused, reusable
Cute water bottle.
Yeah, cute little water bottle. We also have this little notebook, with a pen. If you want to write down, anything about breastfeeding, how's it going, just a notepad if you want, diary. We also have this cute little keychain.
It's very nice.
I don't know if you can see it.
Yeah.
There you go. Then we just have this cute little bracelet.
It's very nice.
Yep. And some lip balm. And I think these are called, what are they?
This is for the cell phone.
Yep, that's for the back of your phone. You can, wrap up your headphones in it if you want. And then, of course, the bag as well.
Yes.
So those of you who, like the video are able to follow us and also come to Whitney Young WIC, you are eligible for this prize.
Yes. What is, I think it's beyond.
You gotta translate.
Obtenemos esta bolsa, la bolsa, perdón, La bolsa que mi compañera Kendra le enseñó y todo lo que tiene son los beneficios que vamos a obtener para 20 madres que nos estén siguiendo, que nos comenten y que hagan preguntas a las primeras 20 madres que participen en el programa de Week de Whitney John. Serán premiadas con estas bolsas, con los utensilios que ya ustedes vieron que mi compañera Kendra les enseñó. Y aquí estamos para ayudarlas a ustedes en cualquier pregunta que tengan para nosotros.
All right. So we are planning and hoping that our next video will be out on February 22nd. That's what we're hoping for.
Yes.
So be aware. We'll hopefully be going over our personal experiences with breastfeeding, along with any questions that you guys might have. You're welcome to leave any questions right now if you have any. If not, you can also contact us at any time. Our office number is 518-465-9387. 9387. And we also have a breastfeeding hotline number, which Gerda and we both cover.
Mm-hmm.
This phone number you can call anytime you need us, during the day, middle of the night, weekends.
24 hours.
24-hour service for you guys that need help. And that number is 518-221-7183.
Sí. Aquí estamos para ayudarlas. Está mi compañera Kendra y mi nombre es Gerda. Estamos aquí para darle soporte en su embarazo o en su lactancia de su bebé. Tenemos el número de la oficina, que es el 518-493-6387. También tenemos una línea 24 horas, los 7 días de la semana, para darle soporte en cualquier ayuda que usted necesite en cuanto a su amamantamiento. Que el número de teléfono es 518-221-7183. Nos puede llamar para cualquier soporte, aquí estamos. Nos encanta nuestro trabajo, nos gusta bastante ayudar a las madres y estamos motivando a las madres a que amamanten, a que le den ese preciado líquido a su bebé. Y aquí estamos y todos son bienvenidos.
Okay. I don't see any questions in the chat box, so
Not yet.
Not yet.
Volveremos a tener un live de nuevo febrero 22. Esperemos que para ese tiempo ya hayan más madres suscritas y que nos sigan y que nos den like. Y si tienen alguna pregunta, siempre pueden llamar y comunicarse con nosotros.
Oh, hold on. If you have any questions or concerns, please feel free to call us, leave a message in our Facebook page. If not, stay safe. Always wear your face masks.
Yes.
Always wash your hands. Just be safe. We hope that this information was very resourceful and helpful for you in your decision to either breastfeed or formula feed.
Formula feed, yeah.
We support you no matter what, and we're always here for you.
Okay.
All right?
Okay.
Have a great day. Bye.
Gracias. Now I say the end and you end.
Yeah. This is the video now. End.